The president's healthcare law has been upheld by the Supreme Court, but Mitt Romney says if he becomes president, then that's the first thing that he plans to repeal. Joining us now is Ezra Klein of The Washington Post. Good afternoon, Ezra. And you yourself heard Mr. Romney today. He says he'll repeal the law on day one. Is that even possible?
It would be a very long day one. No, it's not possible to repeal the law on day one. When Mitt Romney is being more careful, what he says is he will begin the process of issuing out waivers to exempt states and other groups that would be under the regulations so they don't have to follow them. There's not actually evident authority for him to do that. There's a waiver process that begins in 2017. Maybe you could accelerate it. It's not clear what he could do there. What he could do, and the reason I do think it is serious that within his first year, certainly, he could repeal the law or at least change it beyond recognition, is it using the budget reconciliation process, which means it can't be filibustered. That's all you really need to know about it. He could take all the money away from the law.
Right.
Couldn't do it on day one, but he could take all the money out of the law. And if the law doesn't have any money and then you start doing waivers over time, you essentially make the law completely toothless.
And well done, Mr. Romney. You then remove 30 million people's health insurance.
Yes, you do. In fact, I'll go further than that. Mitt Romney has one plan to repeal the law, which takes 33 million people off of health care insurance, and another plan to do a particular cut to Medicaid, which would take about another 14 to 19 million off. So the number of people with health care insurance who are hanging in the balance in this election is about 50 million when you add up all of Romney's and Obama's proposals. A
remarkable number. He's also made a lot of spurious claims today, Ezra. For instance, he says the law raises taxes by $500 billion and cuts Medicare by an equal amount. Can you fact-check that for us?
The law does cut Medicare by quite a bit, and it does raise taxes by a fairly large amount. I haven't run through Mitt Romney's numbers exactly, but roughly speaking, that's not incorrect. Remember, the law is going to cost a bit more than $1 trillion over its first 10 years. The way it pays for itself is by spending cuts and tax increases. Now, those tax increases mainly fall on the very wealthy, particularly the early ones. It's particularly a tax increase in Medicare, where very high earners pay a little bit more. A lot of the Medicare cuts are coming from a program called Medicare Advantage. It is overpaying private insurers to offer the same coverage as Medicare. It was supposed to be that they would offer it for cheaper. Turns out they offer it for about 20% more. We're basically cutting that 20% off. So people can argue whether the spending cuts are good or bad. I think they make sense, actually. But I will just note there's a deep tension here. When Mitt Romney says all this, that we have $500 billion in Medicare cuts, these tax increases, Mitt Romney wants to make very large cuts to Medicare, to Medicaid. You can't cut government spending without cutting government spending. And beyond that, when Mitt Romney then goes on and says the law is a fiscal disaster, you can't have it both ways. Either it's paying for itself by doing these spending cuts and tax increases, or it isn't. The game Republicans like to play here is they attack it for all the ways it pays for itself and then pretends that it doesn't pay for itself.
Indeed, and of course, let's not forget that Romney says he would increase the size of the military, but never explains where that money's coming from.
Right.
Ezra Klein, thank you so much.